Welcome to this edition of UroChat. My name is Steve Cooper, and with us today we have Dr. Blick as well as Harold. And Harold's a recipient of the inflatable penile implant. In our last episode, you may recall, we interviewed Harold with Dr. Blick, and Harold shared with us his story about prostate cancer and then what resulted in having erectile dysfunction, and he was at that time preoperative. So now we brought Harold back into studio with Dr. Blick, his attending physician, and now we're going to have a nice conversation about how the surgery went and take it from there. So Dr. Blick, if you don't mind, you want to maybe give us an overview of the procedure and what happened and the current status?
Yeah, from my perspective, we saw, you came to the office, we had an opportunity to do a thorough history, physical, informed consent process around the penile implant. And after a thorough discussion, I think we answered all your questions, did our best to set realistic expectations, and hopefully at the end we agreed that it would be a good idea to go ahead with the penile implant. We agreed to proceed, and then let's just say 3 to 4 weeks later, we met again in the operating room at the bedside, if you would, in the preoperative holding area. We usually go over everything again, and we kind of have an opportunity to answer even more questions. And then at that point, we went ahead and did the surgery. The surgery, in my opinion, went very, very well. I thought it was a successful treatment or procedure. We do the procedure in about 35 to 45 minutes through about a 1-inch opening. Put all the implant in. There are 3 components to a penile implant. So we put a pump, a reservoir, and cylinders into place. So it was an internal pump that we applied. And we kept him completely inflated. After the procedure, went home with a catheter, a drain to pick up extra fluid, and we had him wrapped up real tight with a compressive dressing. The next morning, in under 24 hours, we saw you back after a pleasant evening, I assume. And what happened there is we took the catheter out, we took the drain out, we deflated you. I think to everyone's surprise, it truly did look like we didn't do surgery. It really is no black and blue, there was no swelling. He was uncomfortable, of course, overnight because of the catheter and having, a procedure done, but relatively modest recovery overnight. And then ultimately we got everything off, and then through the week, we allowed you to recover. We saw you back at week 1. We removed staples at that time, and we deflate the penis fully at week 1 because we kept you partially inflated through the whole first week. That's important for the success of the treatment. And then ultimately by 3 weeks, we saw you back for inflate and deflate training. You were completely healed, for the most part ready to undergo that training. And then my understanding was there was a little hiccup. There were some issues with learning how to do the inflate and deflate, and there were some concerns, and we saw each other in consultation yet one more time. And it sounded like we were able to work through that in consultation. And I think at this point we're going to hear from you more and learn more about your experience with that whole process from your perspective and where you're at today.
And you threw something out that I've got to ask about, Dr. Blick.
Please.
You had mentioned that Harold left with an erection. Is that true? And was it for 24 hours and then for a full week, partially erect?
So we send everyone home completely inflated because it helps with the postoperative healing process. Okay. It allows the implant to set and allows them to have less bleeding and hematoma. So that's why the post-op day 1 is so good. That minimizes the swelling, minimizes any black and blue, and makes the post-operative recovery easier. And it is for 24 hours only. Actually, it's probably less than 24 hours. And then we leave them 50% inflated over the week in a similar fashion, and also designed to allow the implant to set well within the penis so that it's a better long-term success.
So that's short term. That's not the same as a natural erection, that after 4 hours can be, as we've talked about, a real medical emergency, correct?
So with a penile implant, you don't have to worry about that 4-hour limit. You could keep the penile implant erected for several days, even a week at a time, and it wouldn't matter, because we're not really having a lack of blood flow in this situation where blood gets trapped and goes to low oxygen. So we're not having a similar situation as someone who has something called priapism or a painful erection that won't go away. This is completely different, and a true benefit to the penile implant is that you can keep the erection really for as long as you want, whenever you want.
So Harold, I have to ask you the number one question: does it work?
Yes, it does. It does work. A little training. Had to go back, like Dr. Blick
Okay.
had mentioned. Had to go back and have a consultation with him. A little more. Actually, it was a training session with him, and explaining the pump and how to inflate it and deflate it, and just the technique of doing it. And I think that was my problem, is I've never, had it before, so I wasn't sure of things, and like, for example, the little pump ball, he was explaining about how to use that correctly, and if it deflates, or squishes all the way together, then that means that something's wrong. You need to reset it. So it's, I guess, you would call it the pump mode, but
activated mode,
activated
deactivated mode.
right, yeah. But I had to learn that, and he explained that, and after that, it works well.
Oh, that's fantastic.
It's nice to hear. There is a learning curve, like anything, and it's different, of course, for every patient. Every once in a while, you have a patient will learn it in one session, but on average, some people take 2, 3, 4 sessions sometimes to learn. And I always encourage the patient to come back in, and if they're not immediately getting it, and have another time with me to just go through everything. So on average, I'm going through 2 to 3 sessions sometimes, just to make sure people really got it, understand it. I try to make myself accessible, so even now, if you thought you still had an issue, I would say, please come in again, and let's have another time, and we'll train again. And everyone learns how to do it, because in the end, it's just like anything else, like tying your shoes. In the beginning, you might have fumbled, but in the end, you don't even think about it. And that's what will eventually happen. It'll get to a point where you don't really give a lot of thought to how you do it. You're just going to become on autopilot on it eventually.
Similar with the artificial urinary sphincter, I typically don't even know that I've activated it when I go to urinate. So very typical men report to you that it becomes it's second nature, if you will?
Absolutely, yeah. Over time, you're going to become more and more comfortable, and the most important part is we have the relationship, and we can communicate, and if there's something not perfect, we address it and we solve it.
Right. And my first question when I was learning to pump up the pump, when I was either pumping it, too rapid or too hard, and it got squishy, and then I'm like, oh, I broke it. That was my first thought, is I damaged it or I broke it, but that wasn't the case.
It's very hard to break it. It's a very resilient, relatively strong product. It's got a very good durability, lifespan to the product. So I usually will quote 90% success, mechanical reliability at 10 years. So it's going to be good. It's really hard to break it. So I encourage people to pump it, get it completely full, and then try to over pump it to get that extra rigidity so they get the better result. In other words, I'm not afraid of you over pumping it, because you really can't break it.
Right, and that's what you were teaching. That was some of the technique that Dr. Blick was teaching me in our second consultation, is all those important little details about how to do that, and understanding how the whole system works.
Well, I'm really glad you went back to Dr. Blick and had that conversation. It seems like that relationship with the provider is so critical, and I'm glad that you felt comfortable to go back and say, hey, if something just doesn't make sense, you addressed it, and then now you're good to go. So
I have some questions for you. How is it waking up after surgery? Were you in a lot of pain?
No.
Minimal pain waking up?
Yeah, minimal pain, and then...
How was the first night?
The first night, the catheter is that's just like you said.
There's no man that likes the catheter.
That catheter,
0%.
you can get rid of that thing. I hate that thing.
And you have experience with the catheter. You were catheterized after your prostatectomy, correct?
Yeah, that had to be in, I think, 9 or 10 days, or something like that. And that's terrible.
It's awful. Yeah.
But once, like Dr. Blick said, after it was probably less than 24 hours after I left the hospital, and I was back in seeing him, catheter out, and and then they deflate somewhat, and then went back home.
How was your first week?
I would say good. Looking back on it, I didn't have a lot of pain issues. In fact, the prescription and everything got messed up for the pain medication, so the only pain medication I really had was what they gave me at the hospital. And then from there, I didn't really have any pain other than, maybe taking a couple Tylenol or something like that. And then I didn't even need that. So
That's impressive. That's awesome.
It was not painful at all.
Fantastic.
The only thing I would say is that probably the worst thing is the itching, which I think Dr. Blick said that's from
From the shave.
From the shave, right?
That
From your manscaping.
The hair growing back.
yeah,
Sure,
from the,
yeah.
what did you say?
Manscaping.
Oh, the manscaping, is that what you call it? Okay.
Yeah.
So the
But-
first week went well.
Right.
And then maybe walk us through how did recovery go after that?
Pretty much like Dr. Blick said, went back that first week, and
That's when you were then deflated fully, correct?
correct.
Okay.
They deflated one of his other doctors. I went and saw, and she deflated, and then she took the staples out. Which, by the way, I have to compliment you. Boy, that was a lot better job than what they did on the prostatectomy.
Right.
With the staples. But
Well, we had we have a much smaller incision. We have
Oh,
a very
is that
small,
why?
We have a tiny little incision.
Oh, it's not that big.
Yeah,
then.
yeah.
Okay.
But that's why ours is like a 3 centimeter, a little more than an inch.
Compared to the prostatectomy that, whether it's Da Vinci or not, is going to be multiple incisions, correct? And
Well, actually, you had Da Vinci, so you probably had really small incisions anyway.
I did,
But
but the
multiple
largest
ones.
one is right here,
Yeah.
and with the staples, my thinking was that they didn't leave them in long enough,
I see.
because I started, after they took them out, that skin started to
Separate?
exactly, separate, and anyhow, that left a much bigger scar,
Sure.
from that.
Let me ask you another question. Once you got to being able to inflate, deflate, how do you view the quality of the erection at this point in time? I mean, now that we've gone through some training, got you to a place, in your own words, where are you at with the quality of your erection, and maybe a little bit about the quality of sexual relations and intercourse, if you're willing to share?
The quality of the erection, now that I understand how to do it, I was thinking right away Friday when you reinflated me when I was in the office. I could tell immediately that it was completely inflated, because you can feel that little bit of pressure where what would you call those? The tubes, whatever, the cylinders
The cylinders
in the shaft. When you get that completely inflated all the way, then you can kind of feel that a little bit. But no, it's very firm, just like you said, and it's just a matter of learning how to do that, and getting it inflated completely.
And does this help restore some confidence and a connection in your relationship as well?
I believe so. My wife says I'm different. She says that I'm more relaxed, and that's what she says. She said she could tell a difference. So.
Can you please yourself? I mean, can you have an orgasm? Can your wife have an orgasm?
Yeah, I can.
That's awesome.
Yeah, I can. I'm working on that we were talking about that on Friday and everything.
Well, one of the advantages of the implant is that you can now officially control the entire sexual experience. You can now have, with confidence, once you get really good at pumping, you'll be able to obtain a rock solid erection for as long as you want, whenever you want, and you can go as fast or as slow, for as long or short as you like, and you can control your sexual tension and her sexual tension in a way that maybe normal guys, not the average normal guy, can. It's a more powerful, more unique, sexually enhanced version of of Harold.
Right, right, and that's true, because
be that,
once you have it inflated and hard like that, it's until you deflate it, that's the way you're going to stay.
That's great. Let me ask you, Harold, how long from after your surgery did you have to wait until you're able to actually have intercourse?
Oh, I think after Dr. Blick, I saw him, I think the 3rd week, I believe, and that's when he did a training session, the first one, and started teaching me how to use the pump and how it worked. And
so you're green lighted about 3 weeks post-operative?
3 weeks to 21 days is we give them clearance to learn how to inflate, deflate, and if they're okay, they can proceed with normal sexual intercourse. Yeah, 3 weeks.
And I assume you'd like them to take it a little bit easy initially. Is that?
You know, you don't have to. I think if you're ready, your wound is well healed at 3 weeks. There's just no signs that the surgery's there, except you're a little sensitive, probably still at 3 weeks. So at 3 weeks, you may still have some slight sensitivity, and that may slow the process down. And that's going to vary from patient to patient. But if you're up for it, and you're really clear at 3 weeks to proceed with sexual intercourse, sexual relations in the way you're used to.
Right. And that's right, because shortly after that we did have sexual relations. So it was not long after I saw you, after that 3rd week visit.
Oh, that's great. And Harold, a question that a lot of men ask me about the device that you have is, how does it feel? Like right now sitting here, do you feel it? Can you not feel it? Do you feel like it's deformed your body? Things of that nature. No,
it hasn't deformed my body at all, and I can't feel it. The only time, like I was explaining, the time that I can feel it and I know that it's working and it's completely rigid is when it's pumped up and it's completely full. And I think another thing that's important that you explained to me on our last visit was about getting all of that out and get it into the chambers, or you were explaining
into the reservoir.
Empty. Does it actually empty or not?
It does. It empties out into a reservoir that holds all the fluid. So fluid is moving from a reservoir into cylinders for the erection, and then it's moving back into the reservoir for deflation. So I just like to get guys to be as deflated as possible when they're not using it, so that they are more natural and not having their penis rub against their body, so that it becomes invisible to you.
Right, and that's the way it feels. It doesn't. I mean, when you're deflated, it feels pretty normal, in my opinion.
And we're only at about 4 or 5 weeks now, maybe. Wow. In 3 months, the body forms a pseudocapsule around this, around the implant, and it becomes yet ever more natural.
Oh, really?
The pump will become sitting in the scrotum almost like another testicle, like completely invisible and soft and mobile in a way that may be even better than it is today.
Oh.
We're just so early in the process of getting you activating that it improves. And the same thing with the implants through the shaft of the penis. There's a capsule that forms around that, and it gets even more natural within the shaft of the penis over time. So that will happen over the next 6 weeks to 3 months.
Oh, that's interesting. I didn't know that.
Yeah, there you go. Glad we had this interview.
Yeah.
That's fantastic. If there's something that you would want men to know that are going to watch this episode, what would you want them to know about this actual procedure?
The whole procedure overall?
Yeah.
I would, men that are, in my situation, I think it's an awesome choice to choose this, because after the prostatectomy, that was it. I mean, you just don't have anything anymore, and especially when they take out, they go what the surgeon said, wide.
Sure.
There's nothing there, and you're not going to function, period. I mean, that's what my experience was. So, I mean, this is a huge change, and that's what I would recommend to other men that, find themselves, after, prostatectomy, that this is the best choice for them to do.
Well, this sounds like a real game changer for men's health. So I want to thank you, Harold, for sharing your story publicly. I know this is a very sensitive topic, and I really commend you. Dr. Blick, thank you for your time being here.
My pleasure.
Any thoughts to wrap us up, Dr. Blick, on the procedure or the process that men at home should know?
No, I think Harold said it well. I think this is really the single best treatment option for men who fail conservative measures, regardless of their etiology. Prostate cancer is one reason, or prostate cancer survivors are one population of men that I take care of, but we have men that have atherosclerotic disease or heart disease or poor blood flow because of a variety of reasons, ranging from, like I said, atherosclerosis or diabetes, in addition to, let's say, prostate cancer survivors that can also really benefit from this. So if you just fail the little blue pill, the single best treatment option in my mind is the penile implant, because it's a life-changing, transformational procedure for the men who get them. You just heard that it's a modest recovery, and the success rates are really high, and the side effects and or complications are really low, and this is just a perfect example of all that. So it's just about raising awareness. It's not for everybody, but as long as you're aware that it's an option, it really means I can really solve anybody's erection issues long term, and really this is an awesome long-term erectile restoration solution. So
Fantastic.
I appreciate the opportunity to work with you. It's an honor to take care of you, and I really appreciate our opportunity to talk about it with you.
Thank you, Dr. Blick.
Steve, can
Yes.
one
Sure.
other thing I think that's really important is I had a lot of faith and confidence, in Dr. Blick.
Absolutely.
That he was the professional, that he was top in his field, and he was, like a specialist in doing this. And that was really important to me, because you're making this change and you're doing this, and it's not reversible. So, to have that, I think the doctor-patient relationship and having that trust and confidence is also very, very important. It was to me, and that's why I sought out Dr. Blick.
Absolutely. Well, thank you again. Thank you, Dr. Blick. Thank you, Harold, for being here.
My pleasure.
And that concludes this episode of UroChat. Thank you.